Welcome to our guests. I'm delighted to be with our panelists. My name is Annie McCoy. I serve as the Chief Growth Officer at ChartSpan. Today, we're gathered together to talk through the experience of one of our clients, Ryan Health. This is a partnership that we are very excited about, very appreciative of, and honored to be able to partner with Ryan Health. Ryan Health is an FQHC, and the work that we're doing together is very impactful for their patients as well as for Ryan Health, and an opportunity that we really value. So in terms of logistics, we've reserved a half an hour today of your time. We'll present content and have a facilitated conversation for the first 20 minutes or so, and we'll reserve the last 5 or 10 for questions and conversation. We would love for you to share your feedback as well as to raise some questions for us. Leah Flair, who is the marketing director for ChartSpan, is moderating our time together. She will advance our slides, keep me out of trouble so that I don't do anything to damage the audiovisual quality of our time together, and Leah can field questions for us. So feel free to go ahead and drop some questions along the way, and we will make sure that we get them to the folks that are with us today. Leah, would you mind advancing a slide for us? Thank you. So you'll see my smiling face over in the right corner. As I mentioned, I'm the Chief Growth Officer for ChartSpan. It's a privilege to sit in this chair every day. And unfortunately, I spend time in this chair versus out in chairs of our clients and prospects, and don't spend time in a chair in our office anymore either. We're all in a remote position. ChartSpan pivoted, as I think most of us did back in the March timeframe, and became a fully virtual company. So this is the way we meet, and we're delighted to meet with you all today who have joined us for our conversation. I'm joined today by Meredith Gentes. Meredith is the Senior Director of Population Health for Ryan Health in New York. She is a leader in her own right and has created a partnership and a model for serving Ryan Health's patients through chronic care management that we think is remarkable. And we're delighted to bring her to you today so that she can tell her story and Ryan Health's story. She is supported every day by Sandeep Rama, who is a director with our Client Services Organization. Sandeep came to us at ChartSpan with experience serving clients. He had in prior life been with Athena, so he can also unravel the challenges that trying to manage data in and out of an EHR can be day to day. And he has served us well in guiding the company in partnership with Ryan Health. So Sandeep and Meredith are with us today. You will hopefully hear less of my voice and more of theirs. I'll serve as our moderator, MC, talk show host, and guide us through a handful of slides that I think support the story, and do my level best to let Sandeep and Meredith spend their time with you versus me. Leah, maybe you can move ahead one more slide for us and I'll kick us off. So this is where I'll start to bring my colleagues into the conversation. Meredith, we would love for you to tell the group gathered here today about Ryan Health, about the work that you do. And goodness, I'm sure it's been a challenge for the last 9 months, as it is everywhere across the country. But I'd be grateful if you could help us learn a little bit about Ryan Health.
Absolutely, thank you. So I'm Meredith Gentes. I'm a family nurse practitioner at Ryan Health. I'm also board certified in HIV medicine, and I'm also board certified in diabetes education. So I've got a little bit of everything for chronic disease management. I'm currently the Senior Director of Population Health at Ryan, where we look at how we can best take care of our patients using care management, specific disease management services, and of course, in quality improvement. And as Annie mentioned, Ryan Health is a federally qualified health center. We have 7 primary care sites, along with several school-based health and also some shelter-based organizations as well. We serve more than 50,000 patients with nearly 200,000 visits a year. And we have been a ChartSpan customer, had our CCM going since June. Looking back, and I think in the moment I knew that it was a little bit of a crazy time, but we started this program actually in early April when I was personally running our full-time COVID clinic. So I maintain that if you think you don't have time to do this, that's when we rolled this out. So that's essentially, we started working together in April and in the midst of this all. And we were thinking about how can we have our patients, I think many of you, I think, are from FQHCs, understand that our patients will always have a hard time having access and getting a hold of us throughout the day. And we wanted to think about what kind of program we could have that would give our patients better access. Of course, during COVID, when there's a major cutback in the amount of visits that we were having, a CCM program, it can be a source of revenue. But also thinking about our patients and being in value-based contracts, how can we keep them out of the emergency room and keep them healthier? So that's kind of how we came to be running a CCM program.
Thank you, Meredith. Leah, let's drop ahead to the next slide, because Meredith, you were going, I think, exactly where, it's exactly where the conversation should go, right? You'll hear throughout that we're evangelical about CCM, and it's not simply because that's the business that we run. We are mission oriented. We believe that our charge is to help provide I think of it as connective tissue between our clinics, our providers, and the patients that we serve. There's valid reason for why CMS sponsors this program and launched it several years ago. And it really does tuck in, as you mentioned, with your value-based contracts, in the era of preventative care, engaging, activating patients and managing their health, especially those who are at risk with chronic conditions, for the sole purpose, right, of keeping them in that rising risk band versus graduating up into the high risk band. So we are passionate about the work that we do and making sure that we are the partner that enables you to do the work that you do and that your patients benefit from it. I'm going to ask you to go back just a little bit before we change slides to where you were in your thoughts just a moment ago around why CCM. I know that you're a proponent. I know that you are also evangelical about the service, but there's a larger organization that you're part of. And so I'm sure the conversations about chronic care management began long before you met us, as you were thinking about standing up the program and choosing partners. Just tell us a little bit about that. And then Sandeep, warning for you, I'm going to pivot over to you and ask you to talk a little bit with us about the launch plan. It's a very critical moment in standing up a program, is getting the implementation right, getting the launch strategy organized and executed. So warning for you, Sandeep, we're coming back to you. But Meredith, tell us a little bit more about Ryan Health's journey.
Sure. So I look at our decision as kind of a two-part decision. Obviously, as you mentioned, Annie, we were having conversations long ago about starting a CCM program, taking advantage of this benefit for our patients. But it was, when are we going to do it? And then how are we going to do it? And so once we decided that there was a clear need, our patients are complicated and have a lot of needs, both physically and there's a lot of different social determinants of health going on with patients in an FQHC. How can we really maximize how we take care of them, and how can we make sure that we are paying attention to more than just their medication needs? And that required a service beyond what we were currently offering. And that's the kind of program that you can get from chronic care management. We also wanted to think about how can our patients feel happier with the care we're giving them. They like to feel like they can contact their doctor or primary care provider at any time. And so we really wanted to look at what kind of options we had to offer that kind of expanded service to our patients. And that's clearly through CCM, through chronic care management. So once we had decided that this was something we wanted to do, it's okay, how? And looking into it to do independently, that probably stalled us 6 months. Just reading the document, we were like, oh my gosh, this is beyond our bandwidth. So we wanted to not only have a program that could provide revenue, but we also wanted to have a program that was of very high quality. We wanted our patients to be happy with what we're doing. So I didn't feel comfortable kind of throwing together a program that would technically be chronic care management. I wanted to have one that we felt really good about. And so that's when we started to look at how can we collaborate with another organization who can frankly do it better than us, can be available all the time and really be pros at the billing and the triage that you need with your patients. And so that's how we kind of came to the decision that we should look externally and look for a partner. And that's how we found ChartSpan.
Great. I appreciate that. I'm going to keep us on track here and make sure that I keep my comments shorter because I'm eating up some of our time, which I promise not to do. Sandeep, I talk about Ryan Health with you in terms of implementation and think of it as a initially go slow to go fast. Implementation, as I mentioned, is a critical component. Tell us a bit, Sandeep, about how we approached the launch of the program with Ryan.
Absolutely. Thank you, Annie. Thank you, Meredith. And so the goal of any ChartSpan chronic care management program is to ensure long-term success. But that starts with the launch. It's a critical point in ensuring long-term success. And the first and foremost thing we do here at ChartSpan, working with Meredith at Ryan Health, is to ensure that all the providers, all the staff members at Ryan Health are familiar with what chronic care management is at a high level, know who ChartSpan is, and what are the benefits of the program to their patients. This is Ryan Health's chronic care management program. However, with the larger eligible Medicare population that Ryan Health has and our anticipated higher enrollment rates, we took a different approach to taking the program live, to scale it. We rolled out the program by provider. This ensured that we maintained operational efficiency and maintained quality at both organizations. We didn't overwhelm our staff or Ryan Health staff, and we didn't risk jeopardizing the quality of care and the value of the program to patients. It is still ongoing. We've only taken live 6 providers and their patients, and we will continuously roll out the program. Additionally, by going slow to go fast, we ensured that we had the technical piece in place, the integration that allowed for easier claim submission by the Ryan Health billing team, minimal burden to the team by having an integration in place and continuously working to expand that integration to make life a whole lot easier for all staff members and providers at Ryan Health.
Right. Sandeep, thanks so much. It is a tremendous success story. Let me move us ahead, Leah, and talk just a little bit about our enrollment. This is the first moment that the patient actually engages with us. And we take the responsibility there very seriously. We have invested infrastructure and telephony to support outreach to our patients. This is a critical component of growing a chronic care management program in that you have an ongoing and continued enrollment process. It's not a one-time event. It's a critical component, as a strut, if you will, beneath the chronic care management program. What you see here are the data that speak to the volume of patients currently enrolled, and that there are still always going to be a slice of that pie, patients waiting to be consented to enroll. This is, as I mentioned, a recurring function. Sandeep, again, I'm going to keep us on track on time. Take this for a moment and talk about our use of technology that allows us to bring provider voices to the enrollment process. Meredith, then come back to you for just a little bit of insight on how your lens on the enrollment function and how well we've done there.
Definitely, thank you. And at first and foremost, as you can see from the slide, phenomenal numbers and conversion rates of eligible Medicare patients enrolled onto Ryan Health. This is attributed to, of course, first and foremost, the partnership with Ryan Health and ChartSpan. I can't forego that first, Annie. By ensuring that the providers and staff members are trained and know that ChartSpan is available to their patients, and their belief and advocacy for their program, for their chronic care management program, is so key to its success and to the enrollment numbers. On top of that, these enrollment rates are attributed to marketing materials as well as technology. And one piece of technology we leveraged very well with Ryan Health was VoApps, or what we call customized voicemails, of providers at Ryan Health, so that their patients hear a familiar voice about their program, their chronic care management program, and its benefits. That is huge. Their trusted advisor, their trusted healthcare advisor, and that familiar voice increases the legitimacy of the program and encourages the patients to call us back and listen to the program and enroll. And that definitely drastically affected the enrollment rates and worked really well with Ryan.
Sure thing. Meredith, just a thought on that, because I do want to get into a little bit of the meat of the matter next in terms of the services that your patients are receiving, but maybe your thoughts on enrollment.
Sure. So I think the enrollment process was something that as ChartSpan's client, I felt like I really had quite a bit of control over the process in a way that I could make sure that we were comfortable with how fast this was moving. And it was a very, very close working relationship with Sandeep so that I didn't feel like we had to roll it out too fast. We could take our time and make sure we did it right. And I think that was something that really looking back was the right move. We did it slowly and we did it correctly. The enrollment process was, I think our patients all, especially our Medicare patients, they all get phone calls all the time trying to enroll them into things. And the fact that they had my voice really helped. Sandeep reassured me I'd never have to hear the recording of myself, but my patients certainly liked hearing it. And they would come to me and they would ask me. And so I think that it was truly unique. There's a messaging going on that really gains patients' trust in a way that typical cold calls do not work. Care management services cold calls often hit an enrollment rate of 5 to 15%. And you can see that's not the enrollment rate we have. So it was really an impressive process, and it's still ongoing, which is exciting.
Right, and I'd add to that it doesn't have to be a single provider's voice. So we can have multiple providers reaching out, or their voices as part of that outreach. And I think it instills just a ton of confidence. And the data here shows, and we have it across our organizations, that having that voice as part of the enrollment process, the voice of that trusted provider, does inflect enrollment significantly. Let's move ahead, Leah, and let's get into a little bit of the services that we're providing. So a component of chronic care management is having a 24-hour nurse line. So patients are able to reach us 24/7, 365 days a year, COVID or not. And someday we can all talk about what we documented relative to interaction time and enrollment rates and touches that we received during this time, which I think is just a testimony to the having these types of services available. Meredith, you alluded to social determinants and those barriers to care and the challenges of accessing care. I know this is what we're all about. Sandeep, what our guests might need to hear is just a little bit of unpacking what's in the bar graph. So when we talk about education, and maybe even more so notifications, that would be super important to just break out a little bit for everyone to understand. Appointments, I think, speak for themselves. This is our clinical team helping to arrange appointments for patients to get them into a practice, to get them into a clinic for the right services at the right time. And that's something that we do on a daily basis. That's bread and butter for what we do. Sandeep, unpack notifications for us a little bit. Medications would, I assume, be addressing medication questions or helping to obtain refills. The Prepare program, Meredith, is definitely where I want to come back to you after, and Sandeep helps us just understand what's behind those bars.
Oh, definitely. And this is a chronic care management program, but it is more than that. It's about anything, about assisting patients with anything that would benefit their overall health and well-being. And that is also barriers to access resources. And so what we do here at ChartSpan as well is we call them social determinants. We address those barriers that patients might have to get the services that they need. One might be, Ryan Health is in New York, in Manhattan. Transportation needs for patients at a reasonable price or free for patients. We do the research to find that for patients. This is just a small sample size of the type of social determinants we focus on, but coupons, helping with cost for patients for over-the-counter medications or for medical equipment is all included in this service for patients. But for any operation, real-time communication is key. In this case, between ChartSpan and Ryan Health, in real time, we provide complete transparency to Ryan Health on what we find out about their patients, what issues patients might have, or what requests their patients might have. And so this tool we call the notifications, or this communication method, allows us to obtain the information that a patient mentions on a call and provide it to Ryan Health in a digestible way and so that their team can let the providers know what is going on with the patient, if it's a serious issue, or if it's a request as simple as a prescription refill.
Great, great. Meredith, take us to prepare. This is really super interesting.
Sure. So I think anybody who's working in healthcare in 2020 has heard the term social determinants of health and is probably grappling with how do we address them. And so just like all the other healthcare centers, Ryan is also trying to figure out not only how do we address the issues that we're having with our patients are having, but how are we screening for them? And so as an organization, we are moving forward with screening our patients for social determinants of health using Prepare, which is a screening tool you may be familiar with if you use eClinicalWorks as your EMR. And so as a network, if we are screening all of our patients, we really want to be able to not duplicate these efforts, but also really be able to split up and make sure that everyone is getting screened. And so we are using Prepare in collaboration with ChartSpan, with our CCM program. And so our patients will be getting screened by ChartSpan in the same way that they would get screened at Ryan Health. So it really just reflects a cohesive effort. And it's looking into patients, do they need transportation? Do they need help with utilities? And not only are they screening our patients, but they're also addressing them. They're connecting them to the CBOs or organizations that can help kind of close that gap. Because that's truly what is impacting our patients' health. We know this. It's great that they can take their medication for their heart failure, but if they can't have the transportation to get to their doctor for the refill, then they're going to go to the emergency room. So it really is helped us to design a comprehensive CCM that's really looking at whole person rather than just, one part of them.
Sure, that full 360 with that sort of patient life at the center, so important. Thank you for that. Let me jump to the next slide, Leah. This is probably one of our proudest data points and one that I'm going to go by real quickly, unfortunately, for time's sake. We are committed to quality assurance and to assessing satisfaction, not only with our clients, but with our patients that we serve jointly. And so we use the Net Promoter Score methodology. A 95 Net Promoter Score is off the charts, as our subject slide or our title slide gave away. This is patients telling us that they would give the program a 9 or 10 when asked, and we're proud of that. We gather actual qualitative feedback as well. You'll see a simple quote, and we'll put that on the slides out for you all so you can read it and digest it. But we take criticism and feedback to heart as well. So obviously here today we're sharing a highlight, but the score of 95 speaks to the collaboration between Meredith and team and the work that Sandeep leads for us, and we're deeply proud of that. Let me get to one other metric because it's important too, the revenue. The sustainability of the program is really built upon the ability for us to drive revenue to Ryan Health, not only to offset the cost of the program, but for continued infrastructure and investment. Sandeep, talk a little bit, if you could, I've got to be brief, unfortunately, around how we assess profitability, the commitment to that, and then the interplay between you all assessing profitability.
Definitely. And so in this climate, additional sources of revenue is so important for every healthcare organization. So based on the great partnership we have with Ryan Health, the advocacy for the program, and the great enrollment numbers, it's reflected in the revenue. So I conducted a profitability analysis using our profitability calculator. And based on the enrolled numbers currently, just 6 providers at Ryan Health, the estimated net profit over a 12-month period, net profit meaning reimbursement for Medicare minus the ChartSpan fee, with the current numbers would be just over $200,000 a year. But looking forward, right, we haven't touched every single eligible Medicare patient. We're rolling this out. But forecasting, if we looked at it and had the same conversion rates as we're seeing right now with the entire eligible Medicare population, that number would drastically jump to an annualized conservative estimated net profit to Ryan Health of over $730,000. You look at margin, when you look at profit over generated revenue, as compared to industry standards, especially for a service-based model, 48% is blowing it out the water. And that's all attributed to the great work Meredith, the Ryan Health team are doing and working with us with their patients and their care.
Sure. And Meredith, your thoughts on that as well?
Yeah, I mean, absolutely. I think, as I mentioned earlier, obviously there's shared profits here, but it's about the quality of the program. If we did this ourselves, the infrastructure, the overhead, it would probably cost us way more with a program that is not as effective, and also that we just aren't as satisfied with. So we're really excited about not only the direct revenue that you all can see on this chart, but we cannot forget about the lower utilization rates. And of course, the higher customer satisfaction rates with this as well. Those two things are immeasurable and very important to us and our future in health at Ryan Health.
Sure. And I think, the one takeaway that I talk about every day, almost all day, is the ability to scale, right? So many organizations committed to doing this, seeing the value and having the service available for their patients, but to advocate or to allocate the overhead and the infrastructure is too big a lift. And so given that we have built and invested over years to create the structure, you leverage us to create scale for the program. And we're proud of that. Leah, you probably want me to get to a couple of quick questions. Please know if you've dropped us a question and we don't get time for it, you have a way here to reach us. Any one of us are happy to chat more. 3 legs of the ChartSpan services stool. Try to say that a few times fast. Our chronic care management service, which we've talked about. We offer a rapid AWV, which is an annual wellness visit service that we're equally excited to talk about. And for our for our clients who are working with us on the CCM side, we offer some support and consulting around quality management as well, so that you can close those gaps and use the activation of patients to flag them on different services and preventative care steps they should be taking, which help you close your gaps. Leah, I saw one question about sending our handouts out. Absolutely. We'll send you the material that we've covered today. Thank you for joining us and for being interested in having the content after you leave us. In terms of the structure, the financial structure, and what partnership looks like, love to talk about that. We'll certainly be happy to jump on the phone and talk through that. And I think that our pricing for our services is definitely created so that we help our FQHC partners stand up the program and see the type of returns that we talked about here today. Leah, with 2 minutes to go, is there a question or two that you've seen come through that you would pick out for Meredith or Sandeep to tackle before we wrap up?
Yeah, for Meredith, what advice would you give to someone considering other options for chronic care management program?
I think it's worth having the conversation internally about what resources you already have. This is certainly, if you wanted a quality program that patients pick up the phone for, so that you can actually do your monthly billing, then you really do need a full team. And so if you have that infrastructure already, I mean, good for you. That's very lucky. We certainly didn't, and we really, I'm so pleased with our decision to collaborate with this. It was easy for me. Like I said, I did this during New York City April COVID. It was something that I can't believe how quickly it got up and rolling. I'm so satisfied with our decision to make sure that we collaborated with ChartSpan.
Meredith, I thank you for that. The partnership will carry on and maybe we'll come back together in another 6 months and keep telling the story. It's been a delight for our team to work with you. We're grateful that amidst everything else going on, you could carve out some time to be with us. Leah, I'm going to bring us to a close and thank everyone who joined us today, also carving out a half an hour of your precious time. Stay in touch with us. We'd love to chat. And if there's follow-up information that we can send your way above and beyond the slides, we are delighted to do it.